Good morning, good afternoon, good evening. I'm John Barnes, Executive Director of Funders Concerned About AIDS, and it's my pleasure to welcome you to today's webinar, highlighting the findings of a new report commissioned by FCAA in partnership with the Elton John AIDS Foundation, entitled Converging Epidemics, COVID-19, HIV, and Inequality, Community-Led Lessons for Funders. I'd like to thank the Elton John AIDS Foundation for participating with us in this effort, and especially colleague Lindsay, who chairs the FCAA COVID-19 Learning Group. The group is comprised of leaders who have engaged in COVID relief efforts focused on marginalized populations. I'd also like to thank the members of the Learning Group, as well as the grantee partners for informing this report. I'd also like to thank the co-sponsors of this webinar, especially funders for LGBTQ issues who've participated with us every step of the way in the Learning Group. Other co-sponsors include Africa Grantmakers Affinity Group, Catalyst of San Diego and Imperial Counties, Funders for Reproductive Equity, Global Philanthropy Project, Grantmakers in Health, United Philanthropy Forum, Washington AIDS Partnership, and Washington Regional Association of Grantmakers. And now a few words about how we got to today's call. As I mentioned, the COVID-19 Learning Group was formed to help navigate the rapidly changing landscape at the beginning of the epidemic. We wanted to share lessons learned, but also attempt to coordinate relief efforts. Importantly, we also wanted to capture the innovations, both on the part of funders and implementers, that were emerging in response to the challenges of COVID-19. We began to feel like we were drinking from a fire hose. We needed to bring in additional resources to help us capture all that was going on around us. We ended up making the very wise choice of bringing on a team of consultants who immersed themselves in the emerging reports and engaged in global outreach to funders and implementers, resulting in the report we're going to highlight today. I'd like to thank our consulting team, including Roxana Bonnell, Becky Tolson, Fatima Hassan, and Christine Campbell, who also facilitates FCAA's Racial Justice Working Group. The findings we'll discuss today tell the story of disenfranchised communities caring for their own. It's not a new story, and the challenges are not new either. They've just grown exponentially. The recommendations we'll review today represent an opportunity to double down on what we know works. I look forward to that discussion. To facilitate that discussion, here are a few notes on logistics. We invite each of you to introduce yourselves by placing your name and organization in the chat box. All attendees will be on mute. The session is being recorded. You can offer comments via the chat function and questions via the Q&A function. We also encourage you to raise your hand to ask questions live during the panel discussion. And so now, with no further ado, it's my pleasure to introduce Colleen Lindsay of the Elton John AIDS Foundation.
Thank you so much for that, John. It's a pleasure to be with each and every one of you all today. I would be remiss if I didn't also reciprocate and amplify my appreciation to John and Sarah for your partnership over the course of this learning and your efforts to coordinate the webinar this morning, particularly with the helpful support of funders for LGBT issues. I also want to add my thanks to Becky, Roxana, Christina, and Fatima for your incredible work on the report, and especially recognize the many valuable contributions from colleagues and implementers who joined us in the COVID-19 Learning Group. For me, this conversation has been occurring for a long time, and as I'm sure many of you relate to that experience, for many of us on this call that are terribly familiar with the challenges of responding to public health emergencies from our experience with the HIV pandemic, particularly when communities have to respond on a dime in the face of such adversity and inequity. Globally, key populations describe or comprise communities that are least often included in national public health strategies and emergency crisis responses. And COVID-19 has brought even more loss to these communities, both in terms of life lost, as well as income and prosperity opportunities that have been lost. In addition to that, they've experienced more violence and more discrimination from the healthcare system, as well as in their very homes due to the lockdown restrictions and them not being able to live safely in their own skin. This discussion is also very personal for me. I've not only lived with HIV for close to 20 years, but I recently lost my father to COVID-19 and have lived among inequity for most of my life. And as such, I find that my liberation is bound up with the liberation of all oppressed and marginalized communities across the world. Last week, the CDC declared racism to be a serious public health threat in the United States. And just this morning, I was reading articles on NPR that memorialized the inequities across the United States. I also saw that sex workers, people who use drugs, LGBTQ individuals, young people, and people living with HIV who have already been underserved in the response to HIV saw their disparities and health outcomes worsen under COVID. As we began, and even after 20 years of working in HIV, mostly within the United States, I remain incredibly impressed by the resolve and ingenuity that community displays during times of crisis that are well documented in the report that we're going to discuss this morning. There are so many examples around the world of where governments could not or would not act, including adaptations that responded to IT and bandwidth limitations, that have built capacity to connect with beneficiaries online, that address supply chain challenges, that have moved around and maneuvered around healthcare delivery challenges through the use of community health workers and better sensitizing healthcare professionals. And finally, the biggest one, have achieved and documented and continue to push around critical policy changes. I'm so very proud that AJAF was able to join so many other funders and implementers to support many of these critical adaptations and the learning that came from community when they stepped up and stepped in. So this call today was going to give us the opportunity to herald the heroic efforts that helped all of us survive the deadliest pandemic of our lifetime, and discuss how and which of these recommendations from this crisis response each of us are able to carry forward in our work. So without further ado, I'm going to turn it now over to Roxana Bonnell, who will share an overview of the report findings and lead us into further dialogue. Over to you now.
Thanks, Colleen. Thanks, John. Good morning, good afternoon, everyone. As Colleen said, my name is Roxana Bonnell, and I am one of the consultants who worked on the report. I am going to start this session by sharing 3 of the big picture findings and related recommendations connected to those findings with all of you. And then we're going to go into a panel discussion of some of those findings. So the first big picture finding that comes out of this report is that the challenge today is really anchored in unequal, discriminatory systems, structures, and laws that have been around for a really long time. COVID did not create this unequal and discriminatory system. It just deepened and highlighted some of the problems that we on this call, I think, have all been aware of for a long time. Donor funding has supported work to transform and reform these systems and structures. And that funding picture has gotten a little bit better in the last years, but is still chronically underfunded in order to get us to a transformed system that's anchored in equity and a just society. Particular systems and structures that broke down, that were highlighted in our interviews, include food and shelter structures, healthcare structure, access to healthcare structures, addressing mental health challenges, technology inequity, and gender-based violence and other human rights concerns. So if there's one message that came out clearly and at the top of every interview, it is that we must, in the US and global setting, address these unequal and discriminatory systems and structures. And this is not only about donor money or even about donors putting more money into this. It is also about donors being willing to step up to the plate and be direct advocates and voices for the societal change we need to see happen. So that is the strongest and the first finding from this report. I hope that doesn't surprise anyone. Second big picture finding is that for decades, communities and activists have been developing strategies, approaches, and actions to make themselves and their communities healthier, safer, and more functional. What we heard strongly, I think, in every interview was that over the last 14 months, communities saved themselves. And when we asked the communities and networks, so what are your new innovations over the last 14 months? A very strong message, I think, in every interview was, you are asking the wrong question. This isn't about new innovations. This is about us as a community doing what we know how to do. We've been doing it, especially in the HIV community, for the last 2.5 to 3 decades. Yes, we have deepened certain approaches over the last 14 months. Yes, we've made some adaptations, but we always do that, no matter the circumstance. And so the message, I think, coming from the interviews is, don't pay so much attention to new innovations. Fund communities to do what they know how to do. And so if you put those two findings together, it's like, fund, support, be an advocate for structural and systemic change that gets us to a more just society, and combine that with funding communities to do what they know how to do, what they are experienced at doing, and what they are positioned to do. So now tying that to the third big picture finding. Communities, networks, activists seek actively to build stronger, strengthened relationships with donors. And those relationships are not only about money. Those relationships are about strategy. Those relationships are about priority setting. Those relationships are about voice and advocacy. And really finding ways to bring community closer in to all of those processes and decision-making. And one specific way that was a mechanism that was highlighted in many of the interviews was the important role of intermediary funders. That intermediary funders, almost all of them by definition, are closer to the community, sometimes are members of the community. And in almost all circumstances, are more flexible in terms of being able to bring in community to strategy conversations, priority setting, governance settings, right? Decision-making settings. And so a really strong support to elevate the role of intermediary funders moving forward, to be able to set us all up to not only address health crises like pandemics, but these bigger systemic, structural, and legal changes that need to happen in our society. So those are the three big findings. We're inviting everyone to read the full report, but I think everything in that report kind of comes back to those three things. And so now I'm going to turn it over to Becky to open up the panel conversation that will delve deeper into some of the findings and some of the perspectives around these three big picture findings from the report. So Becky, over to you.
Thank you so much, Roxana, for laying out these key themes, that really overarching themes that informed the full report. So to build on what Roxana has shared, we're just thrilled to have a fantastic group of 6 panelists today, all of whom either represent, work with, or fund marginalized communities and community-led organizations, both in the global context and in the US context. And Christine, my colleague Christine, and I are going to ask them to share some reflections around 4 areas that, again, kind of are connected to these themes that Roxana articulated. The first area is around, community-centered, community-responsive funding practices, how to do that well, and what needs to happen going forward. The second area is engagement of communities in a really meaningful, substantive way in funder governance, strategy, priority setting, and decision making. The third area is the use of funder voice and advocacy to address the structural inequalities that marginalized communities face. And then the final piece, which is sometimes the trickiest, I think it was important even before COVID, but even more so now, this question of how funders can better coordinate and collaborate to meet the needs of marginalized communities. So those are the 4 key areas. I'm just going to briefly introduce our panelists by name, and then we're going to jump into some questions. We have on the global side, Judy Chang from the International Network of People Who Use Drugs. We have Stasha Plechas from the Sex Workers' Rights Advocacy Network, and David Clark from Frontline Aids. Then on the domestic US side, we have Dafina Ward from the Southern AIDS Coalition, Jesse Milan from AIDS United, and Marco Antonio Quiroga from the Contigo Fund. So we're so happy to have all of you and really looking forward to your reflections. We want to encourage participants to use the chat if they have comments and reactions to what our panelists are sharing, and the Q&A. You can feel free to put some questions in the Q&A, but we are going to have 2 moments when we stop for more of a live conversation with questions that folks may have for our panelists. So we're going to take the first 3 panelists, pause for some questions, and then Christine's going to pick things up with our other 3 panelists, and then we'll have some more time for open discussion so that we're not talking at you for too long. So I'm going to start with a question to Judy from Input. So Judy, when we did an interview for this report, we talked about the fact that, there was definitely more flexibility on the part of funders during COVID, both in terms of what they were funding and how they were funding. But there was still, throughout the past year, and I think even now, there's still a pretty significant gap between, what funders are doing and what communities, particularly marginalized and criminalized communities, really need. So it'd be great to get some reflections from you about what Input, has done in terms of stepping into that gap to meet the needs of communities of people who use drugs, and what you think funders need to do more of or differently going forward to, really have community-centered, community-responsive funding practices. So over to you, Judy.
Thanks, Becky. Yeah, first I just wanted to, thank you all for inviting me to this webinar as well. So think, just to start by saying, of course, as soon as the COVID-19 pandemic hit, a bit more than a year ago now, which is very surreal to think about. But, definitely, I think from the get-go, Input as a global network of people who use drugs were definitely, at the beginning struggling to understand, how best to support community and get resources down to the ground at the time, of course, when it was needed the most. So firstly, I do want to thank two of our major donors, definitely Robert Carr Fund and the now entered Bridging the Gaps program that did integrate, quite a few flexibilities. And I think, part of that was because I think, as Roxana mentioned before, the donor grantee relationship, it was more longstanding. There was already a level of trust, I think, built into that. And because it was a long-term funding relationship, of course, understanding, that we needed the flexibilities and of course that we needed to be able to support key populations and people who use drugs on the ground as well. So, one example, I guess, of what happened at the beginning of the year is that, we were able to reallocate, up to a portion of our budget, without going for higher up approval, so to speak. So of course, there would have been travel budgets that we had that, were no longer going to be useful. So, I think that, I know it's a simple piece, but, it's not usually, done by a lot of donors, I think, as well. Definitely ones funded by, government, but I think these institutions being, intermediaries, I guess, between governments and communities, that was really useful. And of course, it wasn't only useful for Input because we are a lead of a consortium, and we're also, sub-grant a lot to national and regional networks as well. So these flexibilities, of course, had a real knock-on effect for regional and national and local networks and people on the ground. I would say, of course, it was difficult because, we don't fund, of course, all the regions, and we don't fund, of course, all the country networks. And, a lot of the funding is tied to the global development agenda. So, people in North Africa and networks in, not North Africa, North America, Western Europe, for us, Latin America and the Caribbean region, weren't able to access directly the funding that, we were already getting or being able to channel through. So, one of the first things that we did as Input was put up a resource page and make links to, a lot of donor funds or grants that were being issued for COVID. But of course, there were all these, limitations to them as well. And some funded core funding, but wouldn't fund, activities, and vice versa. For a lot of them, the networks, organizations already had to be registered. And of course, it's really difficult under a criminalized environment for drug user-led networks to be registered, or networks already had to be, funded up to a certain amount. So that, cuts off from the beginning, collectives or smaller organizations that are the most mobile and are the most flexible and have, the strongest connections to the grassroots. So what, we did, when, we realized this, but could also, of course, anticipate some of this as well. We did use some of the reallocation for Input to be able to develop, just our own emergency COVID granting. And it was small, it wasn't large. We're not funded to a huge extent. It was about 20,000. And we were able to use this money to provide funds to 15 networks or collectives, from Russia, Sweden, Italy, but also across North Africa, Greece and Indonesia. And through this, over, almost 2,000 people from the community were able to directly benefit from supplies of PPE, because many harm reduction services weren't deemed essential. So either they closed down or, key workers weren't given PPE equipment. Also, this funding went to being able to deliver harm reduction service supplies, also medication as well, fund treatment, fund transport, developing educational resources, but also funded, advocacy. A lot of people who use drugs were being targeted by law enforcement, and some of the networks, had to directly negotiate or advocate, to prevent this from happening. There was another instance in South Africa where, people living on the streets were detained in quarantine camps, and then weren't giving access to medication. So, there was advocacy needed to make sure that people could at least get access to methadone. So a lot of the things that, aren't really thought about for people who use drugs, because many places just did not know how to address the needs of people who use drugs. Obviously, demand for funds outstripped supply. But, I think it was really important that we were, able to fund people directly and networks directly. And, a lot of our communities obviously didn't have access to social protection mechanisms as well. And, in this fund, we obviously tried to make it as simple as possible, and also, didn't have really intensive reporting requirements or anything like that. So, we definitely say, though it wasn't a big amount, it was able to fund what Carly described as heroic efforts, of the community. Obviously, there was also, people were struggling with their own issues, going to places where, health systems wouldn't go, and often at great, personal risk to themselves as well. And of course, everyone was also struggling with, the fear of COVID and the unknown of COVID. So, I mean, one ask of donors and funders that I think, is important to think about. When we think of COVID, we talk about so much of building back better and doing things differently. And I think, it also needs to apply to how we do, funding, right? And how donors need to be looking at, their practices, because it doesn't reach when, obviously emergencies and crises hit to those that directly need it the most. So I think, of course, there are the due diligence processes, and, these often don't align with community needs. So I think, one way I think to navigate this is looking at and considering dedicated funding streams, that are allocated to key populations, but that go through global or regional key population networks as well, because of course there's that understanding. There's more of an appetite, of course, for risk, so to speak, but there's also this understanding that, we need to be able to, do that to, get resources to the ground. So I think, it's coming up in conversations more and more. But yeah, I think, definitely that's an important consideration moving forward. I think also, for donors as well, I think needing to look at, those communities that don't traditionally receive funding, and that's definitely key population communities. There was a recent report, a Bridging the Gaps, that showed only 2% of HIV funding went to key population programming. And I think the other things that we know that, don't receive much funding, of course, is the advocacy as well, the advocacy for legal and systemic and structural reform. And also, of course, funding, work that is community-led.
Great. Thank you so much, Judy. Yeah, and I mean, I think that highlights a lot of the things that we heard from many folks, both in the global and in the domestic context. And, I think this notion of funding through intermediary organizations, it's kind of an impoverished term. I don't think it captures fully, what the role of intermediary funders are, but like being so connected to community, really in tune with what communities need, and having that flexibility to respond quickly and effectively is so key. So I wanted to turn to Jessie. Hi, Jessie. In the US context, as an intermediary funder, AIDS United I think it's central to what AIDS United does and thinks about its work to be really connected to communities. So could you share a little bit about how you went about understanding the needs of communities during COVID-19? And then, were there some particular practices and processes that you felt, organizationally helped you to respond quickly and effectively to those needs of the communities that you serve?
Sure, Becky, thank you so much. And thank you to John and everyone at FCAA for mounting not only this webinar, but the entire effort. The report was terribly important. And we really appreciate at AIDS United that the report highlighted the role of intermediaries. I think Roxana said something that really warmed my heart, that intermediaries are members of the community. And as a person living with HIV myself for now 38 years, I definitely feel that I'm part of that community. But our intermediary role at AIDS United, we've been playing for nearly 30 years, and we've given away about $120 million over those years. And we've been playing this intermediary role for both corporate and foundation funders, all of whom are members of FCAA. So we feel very close to this work. And I think the report is very clear in outlining the roles that intermediaries play, and that's certainly true for AIDS United. That's being able to be very close directly to the grassroots organizations, the people and the needs. And that refers not only to the larger organizations that are in communities, but the very, very small ones as well. And that includes those that are so small that they're using a fiscal sponsor to do their work. We are able to get close to those organizations and to understand their needs. And I think the report implies, but I just want to say it out loud, that moving nimbly is a role that intermediaries play. We can move very fast and we can move nimbly to make very small grants that larger organizations could not possibly do for themselves in the numbers that are needed. And a role that I don't think is very well articulated in the report, but I want to share, is that intermediaries also have the ability to cultivate coordination and collaboration across funders, particularly where a mediary is engaged in a pooled fund effort. We can pull those funders together easily and say, shouldn't we do this with this pooled fund issue or this pooled fund opportunities? Or we can share with funders across our various projects what another funder is doing and share that information in real time and create a real, I think, leadership effort. And I think leadership for all of us is more and more about listening. And our context for learning what was needed in the field started with listening. And when you listen, you're required, I believe, to respond rapidly to what you've heard. So we mounted a process to not only listen internally, but how we might listen externally as well. So we created a COVID response team within a month at AIDS United. It allowed all of our grant-making program leads to come together to listen to each other about what their concerns were for their grantees, what our grantees might need in the field, and what were the opportunities that they could leverage independently and together across all of our grant-making programs. And then we've asked our leads in each of those programs to make sure that they had heard from a few direct contacts among our grantees to hear what they were experiencing in real time. And what we heard really helped guide where we needed to go. We heard that there was a real fear in our grantees that they would be overburdened with reporting and able to reach the deliverables that were in their grant requirements. So if they were already concerned about not meeting expectations or being able to deliver reports, we needed to respond to that need very quickly. And then there was the fear that there would be a loss of revenue at the ground level, and that fundraising events and even reimbursement and revenue streams would dry up, and we needed to help them with that immediate need. So we made some some very quick changes to make our direct funded opportunities change from project focused to general operating, and we quickly relieved so many of our grantees of the expected reporting burdens that they had for this grant year. But we needed to focus on a way of having a very formal way of listening. And so we created a survey. Rather than relying on anecdotal data, we wanted to create a comprehensive data set that really did tell us what the needs were in the community. And we created this survey and we mounted it at the end of April, and we required that all responses be back by the middle of May. We sent it out to 250 organizations, all of our grantees, many of our technical assistance recipients, and all of our Public Policy Council members. And the responses were amazing. The survey focused on three main areas. What were the staffing changes happening because of COVID? What were the programmatic changes happening in those organizations because of COVID? And what were the client need changes that occurred because of COVID? Well, the responses were tremendous. 140 organizations responded to our survey, and they did so within a 2-week time. 28% of those were organizations that had 5 or fewer employees. That just shows you how important the role of intermediaries can be in getting to those grassroots organizations. A third of those organizations were in the South. We learned quickly that more than 3/4 had already transitioned their staff to remote status, and that 66% had more than half their staff working remotely. And 20% had already laid off staff because of the changes in COVID. So we knew that the needs were great. Programmatic changes were really revealed by our survey. There was a 50% reduction in dental services in the community, and reductions in advocacy and retention services as well. But there were increasing provision of services, particularly around insurance and benefit assistance, and increased services for food assistance. Those were clearly needed. But what we heard also were what client needs had changed. Increasing needs for housing assistance, increasing needs for insurance assistance, and for substance abuse services. So we shared this data in a webinar that we convened in June, and we used this data as priorities for our rapid response that was focused on relief, recovery, and resilience. And so in the summer of last year, we released an RFP asking for a very low barrier of applications, just a letter application with basically a dollar amount of what you needed and what you were going to do. And we used those needs. And when I read some of those letters, I was just heartened how so many organizations were going to enable their community to do the change needed to get the services they need. If organizations were changing to telemedicine and virtual services, how were clients to get there if they didn't have laptops, iPads, or cell phones? So many organizations were using our rapid response funds to buy just those. So we gave away $317,000 within a couple of months. 30 of those grants were to very small organizations, and many of those grants were because of the pooled funds that we have. Many of those pooled funds are with members of FCAA, Gilead, ViiV, Ford, Elton John. All of those made it possible for us to get that money out and respond to the needs. So I just want to share that listening, both internally and externally, was important. Documenting the needs and then responding rapidly, that's the leadership that we tried to provide. And I want to close with just what I heard from a CEO from one of the organizations who received just $5,000 from us through our Relief, Recovery, and Resilience grants. He runs a very small organization for Black gay men in Kansas City. And he said to me last week, the $5,000 you got that they received from AIDS United allowed them to transition the emergency and be better prepared for what they're doing in 2021.
Thank you so much, Jesse. You make a very compelling case for the added value of intermediary funders. And I think, this notion of listening coupled with action is so critical. If you don't have the action, the communities will not see the value in responding to surveys and various other forms of mechanisms. So clearly coupling those two things is so key. And maybe we can come back to this question of the role that intermediary funders can play in collaboration and coordination later when we get to that topic. So I'm going to turn to Marco. So Marco, you wanted to ask you a little bit about the work that Contigo Fund has done to really share power with the communities that you represent and serve, and talk a little bit. I have a feeling that this way of working preceded COVID-19, but that COVID-19 really made it that much clearer that you needed to explore mechanisms to really enable communities to play a role in strategy setting and resource allocation, et cetera. So if you could share a little bit about what you've done, what were some lessons learned that you would want to share for other folks to consider going forward.
Thank you, Becky. So my name is Marco Antonio Quiroga. I use he, him, el pronouns. I'm with the Contigo Fund, and Contigo is the first and only LGBTQ Latinx fund in the United States. It rose out of the horrific Pulse nightclub shooting that happened here in Orlando, Florida in 2016. At that moment, it was the largest single incidence of mass violence in modern history. Obviously there has been so many continuous crises that have occurred, mass incidents of violences, gun violence that have occurred, particularly across the South. And we're in our 5th year of our journey with Contigo, and we have grown since then into the largest community-driven, participatory, and grant-making organization supporting LGBTQ communities of color here in the United States South. Just to add a little bit of context of when we started our work, when Contigo was first emerged, there were 0 organizations here in the Central Florida region that were led by and for LGBTQ communities of color. And LGBTQ communities of color were the ones who were distinctly impacted by the shooting at the Pulse nightclub. And today there's over 20 organizations that are led by and for people, LGBTQ people who are of Latinx descent, Black communities, sex workers, trans communities of color, people living with HIV, undocumented, and rural farm worker communities, all working together here in the community to lead an intersectional movement and around justice for all. And so Contigo rose out of crises, so we're uniquely prepared, and that experience uniquely prepared us to respond to future crises. So when it came to COVID, we already had embedded in us this philosophy of intersectionality, or this value around the self-determination of those who are most impacted, and this strong belief around collective liberation. And so Contigo, since its emergence, I want to share 3 lessons that we learned over our 5-year journey. The first lesson is around how funders can listen to those who are most impacted. One of the things that we did, and one of the things that we do every single time that there is an incident, an emergency response, incidents, rapid response opportunity around an emergency that happens in our community, is that we implement listening sessions, and then we execute needs assessments, community and individual needs assessments. And in the beginning stages of Contigo, we did this as well for the individuals who are directly impacted by the shooting. This helped us build out our participatory process, because through that listening sessions and then community needs assessment, we actually found so many individuals talk about how they've never seen someone who looked like them, spoke like them, had their lived experiences in positions of power, and how they didn't envision that for themselves, and how there was nothing that was led by and for them. So we knew that we had to create a leadership mechanism for folks to be self-determinant. And through that process, Contigo built out its community board, which is our governance, our strategic planning body, and our grant decision-making body, made up of 14 LGBTQ Southerners who represent the full diversity of the LGBTQ community, a multiracial, multi-generational, very important to highlight. The second lesson, funders can center and legitimize non-traditional or non-mainstream leaders. What I mean by that is funders can legitimize those who are most marginalized and most likely to fall through the cracks of the safety network of nonprofits. So undocumented folks, trans women of color, sex workers, folks who are often overlooked, underappreciated, unpaid, or underpaid, but folks who are also deeply rooted in the communities and have the best understanding of what their community needs. The way that we guide our work is we believe that those who are closest to the challenges that our communities are facing and we seek to address are also closest to the solutions that we can implement. And then we believe that those individuals know what their communities need best. And the third lesson is that funders can build pathways into greater influence and power for marginalized communities. We can sustain and cement the transformation that has taken root, because after every crisis, and this is a very important lesson, after every crisis, there will always be compassion fatigue that takes root. And over time, white fragility and white supremacy over time, especially with marginalized communities of color, those systems become complacent as you move further along away from the crises. And so you have to take the opportunity to cement the transformation by building these pathways for those individuals who are directly impacted into government task forces and advisories, into other nonprofit boards, and into other philanthropic institutions. And that's something that we did here in our local region. And today, every single member of our 14-member community board, every single member serves on at least 2 to 3 other boards and government advisories and task forces and other philanthropic institutions as well. And all of our grantee partners that we support do as well. And that's about sharing power and spreading power and cementing the influence that you are able to have in your local communities. So I wanted to personalize it for a second and talk about how this actually shows up in the work. I want to use the story of Joel Jr. Morales, an individual who serves on our community board, who was one of the individuals who, from the Pulse nightclub tragedy, was a HIV tester at the Orlando LGBT Center here, and was the only person. The Pulse nightclub tragedy particularly impacted LGBTQ Latinx communities. Over 90% of those lives who were taken were from the LGBTQ Latinx community. Many of the family members who those individuals came from were monolingual Spanish speakers. There were 0 culturally competent, LGBTQ competent, and linguistically competent mental health services here in Central Florida when the tragedy took place. And Joel happened to be the only Spanish speaker at the LGBT Center, which was essentially the hub of where the entire community landed at when the shooting took place, and became the focal point and the person who was pretty much leaned on in all aspects of that response. It was overwhelming. Because people like Joel, who has that lived experience, best knowing their community, wasn't being elevated in the right ways in terms of supporting their leadership. And since then, Joel has grown into a phenomenal leader. Currently, now he's the operations director for the LGBT Center. And also Joel, since then, has become a sustained emergency response leader for our community, a cemented emergency response leader who has set up the victim services unit when Hurricane Maria happened and devastated the island of Puerto Rico, and we saw an influx of over 50,000 evacuees enter our Central Florida community and support those individuals, and multiple other crises since then. So that's just like one lesson. Another is my own personal experience. I grew out of the undocumented youth movement. I'm a dreamer. I'm DACA mentored. I have DACA. My family came from Peru when I was very young. I have a distinct image of how philanthropy works because it wasn't built for me to access. Philanthropy wasn't built for our communities to actually drive and run for our own communities. It was built in contrast to that. And so for me, it's all about decolonializing philanthropy. From my purview, when Contigo launched our Central Florida LGBTQ Mutual Aid Network and our relief fund to provide direct financial assistance to individuals who are most impacted, from the top of my mind, I knew there had to be a language justice component. And so we translated our application in the 5 predominantly spoken languages here in Central Florida: English, Spanish, Portuguese, Vietnamese, and Haitian Creole. I knew that it had to be low barrier and accessible, in particular for when it comes to ID requirements for undocumented folks, so that we can include them because they've been completely excluded from the recovery, and for other individuals who lack those type of supporting documents. I knew that I had to include individuals who had roots in the communities who are most impacted, and that individuals who could be trusted from a trust-based philanthropy approach. Because through that, we were able to grant out over 1,000 mutual aid, direct cash assistance to individuals, and those individuals were, over 40% of those individuals were from the LGBTQ Black community, 20% were for undocumented communities, either directly undocumented or part of an undocumented family. A third of them were for our trans or gender nonconforming community. These are communities that are the hardest to reach. And we were able to do that because we had individuals, a part of our mutual aid network, who had direct connections to those people. And the last piece is, I understand through this work that we also have to be committed to healing justice, that our leaders are also experience not compassion fatigue, but fatigue from responding to these multiple crises, but also from the trauma that this environment, the social political environment puts on us. And so for every single leader that we fund, or frontline position that we fund through Contigo, we actually provide healing justice dollars for the holistic wellness and care of frontline organizers, of every single person that we fund. So just sharing, the reality is that LGBTQ people, people of color, people living with HIV, undocumented people, people living in poverty will continue to be at greatest risk of the crisis, our future crises, whether that's white supremacy, gun violence, climate disasters, and particularly people, LGBTQ and people of color in the US South and global South. This is a reality that we're going to live through over and over again, because this is the reality of the world that we're in. But there is an opportunity, and just like Roxana said, there's an opportunity to trust our communities to save themselves. And there's an opportunity also to harness the progressive mutual aid power that we've grown, but has been unconsolidated. Our oppressors, the fringe right and corporate leaders, have taken the COVID opportunity to consolidate power in dramatic ways that have widened the wealth gap throughout the world and destabilized democratic systems. And how we're going to do this is by making sure that the power that exists in these mutual aid networks that are working on a hyper-local level are all brought together so that we can build on that progressive power into the future. So trust communities, and let's harness the power of this moment.
That's great. Thank you so much, Marco. And I love that, you end on this moment of like, this is an opportunity, and reflecting on this notion of like how philanthropy is built, like it needs to be rebuilt in many ways to really harness the power of communities and engage them in a meaningful way. So we're going to actually pause for a couple of minutes. We're running a little bit behind and we want to make sure that we have ample time for our other amazing panelists, but recognize that there are a lot of folks with diverse experience on this webinar, and would love to invite you if you have any particular questions around the themes that Judy, Jesse, and Marco have highlighted. Any questions or any comments from your own experience, we'd be happy to hear from you. And maybe also, I know there are some learning group members on this call. Are there things that you're hearing, that you feel like, they really rise to the level of, we need to take this forward as a donor community? Okay. I'm going to pause for 10 more seconds. And if we don't have any questions, I think we're going to go on to our other panelists, and then we're really going to call upon folks to ask some more questions and provide some more reflections when we finish.
And Becky, this is Sarah. I was going to note that, remind people that they can raise their hands if they do want to ask a question live. The Q&A and chat section.
Yeah, please do. Either way. Okay, I think we're gonna go on. Christine, can I pass the baton over to you?
Absolutely. Thank you so much, and thank you to the first panelists. You've been absolutely brilliant. I want to turn to Sasha. As you know, those who hold the money hold the power. And in our interviews for this report, you shared how many of your members come from the middle-income countries where funding and services for sex workers has been cut out over the years. In the conversation, you mentioned the importance of donors, of private philanthropy, of them using their voice and advocacy to help rethink approaches to middle-income countries' funding and access. What advocacy would you specifically like to see private donors prioritize and carry forward over the coming year? Where and how would you like this advocacy to be, and what do you think might be the most impactful?
Hello, thank you for having me. So just to start off in a little bit of a convoluted way, for Eastern Europe and Central Asia, the region where I work, there is the wrong word is hysteria, but there is a hysteria around transitioning out of the Global Fund. And while we understand the alarm around the Global Fund transitioning out of the region, and while we value the work being undertaken by our allies and partners in budget advocacy and transitioning preparedness and so forth, we believe that some of the focus needs to shift towards advocating for private donors and philanthropies towards longer-term support for community groups. And that's because further down the line, if social contracting, so if community groups are ever able to, or civil society is ever able to access government funding, it is highly unlikely that community groups, especially sex worker groups or criminalized groups in general, will be able to get into these types of government schemes. Additionally, there is a severe problem, I would say, of community engagement in country level processes, because community groups usually have to overcome extensive barriers and hurdles to being involved, or they aren't simply provided the opportunities to do so. And if communities aren't able to advocate for services or for funding to monitor those services, then the existence or the quality of those services will suffer. Now, parallel to the Global Fund transitioning, other donors leaving the region further contributes to community groups losing valuable human resources. And this was made painfully clear during the COVID pandemic, especially in the first 6 months, while some donors were halting their work completely with organizations, others insisted on reprogramming. But reprogramming within the framework of the original goals of the program. And that's to say that donors were not flexible enough during a critical period of time to allow community organizations to spend money on food, on PPE, on rent, or other bare necessities. COVID restrictions had a crippling effect on the sex worker community in particular. This means a complete loss of income, a danger of losing homes, struggle to provide for families. And the very limited government protection measures that are in place in the region are not even accessible to most sex workers, which leaves them not only with the meager support of the community organizations and what they're able to provide. The poverty and the lack of support pushes sex workers to violate lockdown rules and keep working. But if they do so, they face huge fines, ill treatment, and arrests. And in the midst of all this, there was an expectation that trainings, meetings, and other activities could be moved online without considering that sex workers were struggling to support their families. And we saw an instant grassroots response from our members. They distributed masks and hand sanitizers, food, rent, money, and they organized to enable people to live together rather than being evicted. But this was mostly from their own resources. However, the pandemic poses a great threat for individual sex workers and the community, but also for the organizations of those communities as well. So national sex worker-led organizations are basically in danger of losing funding. And more importantly, I would say for this context, human resources, because currently it's impossible to meet donor criteria. And their circumstances are such that, as somebody already mentioned, reporting and meeting indicators, it's not just cumbersome, it becomes an impossibility. And to add to it, there is a disconnect between reality, like somebody already said, not just Zoom fatigue, but also people who aren't able to connect online. And of course, for organizations, there's this, there's a level of burnout that we haven't seen in many, many years. So getting back to the issue of the region and the sustainability that's been such a cause of alarm for Eastern Europe, Central Asia, I think it's time to think about sustainability in terms of community organizations. And when we talk about sustainability for Eastern Europe, community organizations are dependent on donor funding. There aren't any social entrepreneurship schemes. There aren't many opportunities that might be available or people might think of in other regions. We spent, so the network, SWAN, and our members, we spent loads of funding. This is donor money on building the capacity of the community over 10 years or more. This is a lot of money. This is a lot of time. This is a lot of effort invested, and it can be lost in no time at all, as we've seen currently during this global crisis. And while we understand the investments, certainly from the Global Fund and other donors, investments in health system strengthening, investments in services and structures, and those are necessary, we believe that investment in grassroots community is essential. Because if communities are left out of these structures and left out of the dialogues, and they're going to be left out of monitoring the services. we're not going to have many activists left if they don't get paid. We're not going to have many activists left to contribute with their expertise and knowledge if community organizations are somehow left behind. And this is to say that, well, to answer your second question, what advocacy in particular, I think it's important to realize that donors now in the last 10, 15 years have actually shaped the funding context. So while we've seen a lot of, our priorities had been, for example, human rights abuses and violence, we've seen our community organizations go through sort of a mission drift, shifting from addressing the immediate needs that they have of the community to more service provision and HIV prevention. And we think that there's a great need for a little bit more of a holistic approach in recognizing interrelatedness of these issues like violence, criminalization, HIV, and health outcomes in general. So advocacy would be essentially around providing institutional support so that the years of funding and effort and trainings gone into community groups are not lost. And this is years. This isn't just one training, two trainings. This is years of investments that could be easily lost. So flexible funding, institutional support, that means sustainability for us. In addition to understanding the context, while some funders are leaving the region is becoming more conservative. And this growing conservatism has a lot of negative effects, not just for individuals in terms of safety and security, but also in terms of safety and security of the organizations themselves. And I cannot emphasize enough how important it is, like somebody else said, mentioned $5,000 and how that can turn around something for an organization or a community. Small amounts of funding can easily make or break a small organization. And of course, in the midst of donors being very focused on what their priorities are, like we've seen a lot of HIV donors in the region insisting on indicators and insisting on results. Yes, it is important work, but we need to contextualize it. And some of our community members could really use support in the larger scheme of things in terms of supporting them in the messages with governments and other stakeholders around decriminalization of sex work. But when the community sees fit, because sometimes donors don't have an ear for when a situation is needs just silence and quiet from everybody around. And finally, just to say that where advocacy would be most impactful, I think it would be most impactful if donors sat together with one another, if they're working in regions together, to listen to the communities together, to be able to understand who's funding what and where are the gaps, and then address those gaps. And those gaps very well might be a tiny little sum for institutional supports so that valuable human resources aren't lost.
Thank you, Stasha. You hit on so many of the key points that we heard from so many of our participants, from sustainability, from the need for donors to really listen to their communities, to collaborate, to build gaps, and really look at how these investments in communities can be long-term investments so that there is some sustainability. And that makes me think about what I want to talk to a little bit up to Dafina about some of the sustainability and how we need to really invest in our communities so that they can access services. In our conversations, we talked about how there was this immediate move to everything moving to virtual and an assumption that everyone could be able to access these virtual communities. We talked about how the move to providing virtual services in the US South was greatly hindered by that lack of universal access to technology. How did you use your voice to advocate for equitable technology access and coordination between public and private funders to ensure South's needs were met? How did you use your role in facilitating these conversations?
Thank you so much, Christine. And thank you, everyone. There's been so much great information and rich experience already shared, and I will try not to repeat. But I can tell you that it became clear, very apparent very quickly that there was going to be a necessity for folks to be able to access a full range of services via technology. And in the US South and across other rural communities, even beyond the South, we know that there is a disparate lack of access to broadband. We know that there is, someone already mentioned, the systemic challenges around access, around economics, around place, around race, and so many other things that limit folks' ability to gain what they need. So we worked from a number of ways. One, we wanted to make sure that the community that we serve across the Southern US, that folks had what they needed and that we were being responsive to those needs. And so in our role as an intermediary funder through the Gilead Compass Initiative, we were able to look at our grant making portfolio and as other folks noted, to make adjustments around allowing funds to be used for general operating support, to minimize reporting requirements, to take that burden off of folks who are doing the work on the ground. We also adjusted our work around stigma reduction funding. We expanded to also include isolation as a key area that we would fund work in. So that allowed a number of our organizational partners to purchase equipment to make sure that their staff, that the folks who were doing the work, had access to the technology that they needed, be it through hotspots or access to a Zoom account or what have you, because things had to happen so quickly and organizations didn't have an opportunity to prepare. So in working with our private funders that we work with and talking with donors, recognizing that that level of flexibility and nimbleness that was needed had to happen immediately, that it couldn't wait. And then in our work with public funders, the fact that so much public funding that comes from the federal level here in the US is re-granted at the state level. And so there is this need to make sure that state health departments understand and really can truly respond to the needs of the organizations on the ground. And that also means expanding funding to be inclusive of smaller organizations, grassroots organizations who have their hands on the pulse of the needs of those communities. And so those are the level of conversations that we've had. What we recognize very quickly is that access to broadband, to internet, to technology, making all of that right, that's a long game. That was not something we were going to be able to resolve in 12 months. It's going to take a long time. And so what we really did want to focus on is making sure that the people who are doing the work had access to what they needed to do their jobs and to reach their communities. So we provided virtual self-care spaces that were peer learning spaces for people in communities. So we had something called the break room. So once a week we had a space where community-based organizations from around the South could get on. We'd have a live DJ, we'd have meditation, and then we just have conversation. And that was just a great way. We started that late last spring and ran that through a couple of months into the summer. And that was really where we learned what folks needed, what the challenges were. And we were finding out that folks were tired. COVID had become hyper politicized. We were dealing with a very challenging national political campaign and array of things, as we all know. And then you added on the layer of the racial injustice that folks were fighting through. And so people were feeling tired. And so we really did prioritize making sure folks who were doing the work had access to what they needed as far as support, be it in the means of grants and technical assistance, and also knowing that they had a peer network of folks across the region who were concerned about them and wanted to support them. We also were able to address stigma, as I mentioned, by addressing isolation. And so expanding our grant making to fund programs that were not just on Zoom, but also just on the telephone, because telephonic support has been extremely important, especially in spaces where folks don't have access to broadband. And so making sure that people had resources. We did peer learning labs around social media engagement, how to utilize the different platforms effectively, whether folks could get on camera or not. And so those are the things that we really focused on initially, was just continuing to have these conversations and continuing to listen. So what we're doing at this point, we're in the process, we have a COVID survey 12 months later that CBOs are completing, just to get a sense of where folks are a year into COVID, because we recognize it's going to have a long range impact. There's going to be a lot of work to do. And what I would say, as far as our work around expanding access to technology beyond now, is recognizing that we've had a lot of leeway because of the public health emergency and the executive orders and a range of other things that have come out that have really allowed us to have a level of flexibility. We can't have that go away. We can't go backwards. And so there is going to be a need for robust policy advocacy and even helping community-based organizations to understand their role as advocates. And that is something that we hope that donors will consider, that funders will look to supporting those advocacy opportunities. We have seen in some communities, specifically in a small town in Kentucky, in Jackson, Kentucky, over a decade ago, they used stimulus funding to expand their broadband, to make sure folks had access to the technology. It changed the game for them economically, the academics, the schools. And so we know that there's an opportunity there, but we definitely need to have the funding and resources to support organizations to do that. And I'll just close by saying that what we see in rural communities is that the lack of access to broadband has far-reaching and can have dire consequences. It's not just about healthcare access, it's also about prevention and education and a full range of needs that people have, and that we do truly have the passion and the commitment on the ground in our communities to drive us to truly having policy and advocacy change that can have far-reaching, beneficial outcomes for communities that have previously been marginalized and disproportionately impacted by HIV and by COVID as well. Thank you.
Thank you, Dafina. I just highlighting the multiple needs of our populations that are not necessarily the traditional needs when we think of emergencies, like technology being a huge barrier, requires multiple strategies to be able to move together and to be able to implement these multiple strategies. Collaboration is key. So as we turn to David, one of the things I wanted to talk to you about, David, is that in an interview for this report, you and Frontline AIDS colleagues shared how the organization moved very quickly in 2020 to try and intentionally collaborate and communicate more with partner funders. In terms of collaboration, what do you judge to have been your most impactful collaboration over the last year? And what would you do differently now, looking back? How have you changed your approach to collaboration moving forward based on this epidemic?
Thanks, Christine, and thanks other panelists. It's been fascinating to hear these amazing insights from really all across the globe. So I guess so Frontline AIDS is a global network of organizations, community-based and civil society organizations working in the HIV response. And I think the most impactful collaboration we managed with a donor or a set of donor mechanisms was our Rapid Response Fund. So the Rapid Response Fund had been in place for 4 years. It had been set up with support from the Elton John AIDS Foundation 4 years ago, really to provide emergency small grants to principally LGBT-led organizations in Africa, the Caribbean, when they were faced with human rights abuses. So, you know, a small amount of money to move somebody from a place of violence to a place of safety, you know, $100 to get them to the city to really kind of rescue people in dire crisis. And so we've been running this mechanism for 4 years and built up a kind of network of organizations and individuals that we knew, trusted, and trusted us. And as COVID struck, we were kind of looking across the piece and saying, look, there were needs coming in left, right, and center into the fund, and we said, so we began kind of amplifying those voices into conversations with the Elton John AIDS Foundation and other funders that we were close with, and said, look, if an organization is going to come to us to access funding, we have this mechanism kind of already set up, ready to go. We can adapt and make some changes so that we can meet those needs. And we said that, you know, the key thing needs to be, they shouldn't have to go, you know, to this part of the website for that type of funding, to that part of the website for there needs to be a kind of single point of entry. So we collaborated with the Elton John AIDS Foundation, and we were able to open up make the adaptation to the mechanism, and open up the call to more countries, to more populations, and yeah, really kind of build that network of kind of contacts and trusted advisors to make grants quickly. Just with the Elton John AIDS Foundation investment, we've made 58 grants in 30 countries, supporting a range of communities: LGBT folk, sex workers, people who use drugs, people living with HIV. Over 40,000 people reached with those investments. And the principal thing that they asked money for was food and shelter. And I go back to a story kind of as we were beginning this conversation with Elton John Foundation, somebody who's worked in the people living with HIV global kind of movement for some time, and I were talking, and she was saying, look, I'm trying to get funding for this organization to just keep these guys alive, keep these people alive. And I was like, well, what about this funding? What about that stream? What about? And she's like, no, they won't do food. No, they're not an existing grantee. No. And so there's something about just being able to meet folk where they are. And so that's something that we kind of kind of coordinated with other funders and provided this mechanism quickly during that period. So yeah, we're incredibly proud of the fact that we managed to organize ourselves in that way, so that communities weren't doing the heavy lifting. We were kind of managing funding from 3 or 4 different investors at any one time. And really to kind of play that important intermediary role that others have touched on. I don't need to go into more detail on it, but kind of working at a global level in Africa, the Caribbean, and Asia. I think in terms of the interactions with donors, obviously there's that kind of whole mechanism collaboration that we need to do. There's also the kind of day-to-day work of or we've been approached to fund in this situation, or we're all working in a given country. Who's funding what? Is there an opportunity for kind of a more coherent approach? Are there places where there's a funding stream that's not being flexible, and that inflexibility is creating knock-on impacts for communities who want to do something differently? Can we make that happen more quickly? So that's something we've done on a kind of day-to-day basis a lot in the last year or so. But I think for this call, I think, like, yes, we need to continue to do that day-to-day level stuff. But I think there's also something about lifting our gaze slightly as a group and saying, where are the areas that this particular report calls us to invest? And for me, there's one that's been around forever, which is how do we respond to violence and human rights violations, so that we're really investing in those national mechanisms that do exist to support people with both with the kind of the immediate support they need, but also the advocacy support they need, the structures they need to record, report, and advocate on human rights abuses. So that's something that's for us is going to be incredibly important to build on and expand, because COVID has exacerbated violence for so many of the people that we, so many communities that we support. I think the second issue that we need to step out of our silos on is social protection and just basic income for people. I think there's a crying need for the donor community and really all of us on this call to look at how is it that there's been the biggest investment in social protection mechanisms and a humanitarian response probably for a generation, but none of it or very little of it has reached the communities that we care about. How is and how can we do better in that space? So I would ask us to say, can we fund initiatives that are kind of working in that space? Can we fund can we look at the $10 million that the Indian civil society mobilized to pull from the global fund to say this needs to go into social protection mechanisms for key populations? They managed to do that advocacy on their own back, and how is that funding going to make a difference in folks' lives? The third thing I think is on mental health, and so for me, this is something that we've heard from all of the panelists so far. So many community organizations are already in that space. And yet there's going to be more kind of global guidance come out about the integration of mental health and HIV care. WHO is just about to put out their guidance now. What are communities already doing in that space that can be invested in, that can be grown, that can be kind of given the due recognition and support that it needs, because not only is that a kind of a benefit for the mental health of those individuals, it also supports better HIV outcomes. It supports better quality of life indicators in general. So for me, there's something about the day-to-day kind of collaboration and coordination that we need to do, but also let's try to get tangible, let's try to get bold in the collaborations that we take forward from this report.
Thank you so much, David. I think just that piece on the collaboration of you being able to pull together multiple funders and being able to be responsive is key to making this work and making it be sustainable in the long run. You all have been absolutely phenomenal and full of great information on and reinforcing some of the things that we've seen as we put this report together. So with that, I'm going to toss it to Roxana and John to really talk about what our priorities and next steps may be.
Great, thanks, Christine. So John, I'm going to come back to you. And using David's language, lifting your gaze up from the report, from all of this amazing experience that we've had shared with us over the last hour and 15 minutes. If you could prioritize the one learning, the one thing that you feel FCAA most needs to focus on, take forward in some way, coming out of this COVID health crisis, and take it forward over the next year, over the next couple of years, what would be that prioritized thing for FCAA, John?
I was on mute. I just want to briefly say that FCAA spent, in addition to working on this report and our racial justice working group, the other big thing we did in 2020 was a new strategic plan. And one of the core principles of the new strategic plan is valuing what we call HIV-informed grant making. And what we mean by that is that over the last 40 years, we've learned a lot of lessons that we're called on to implement even more urgently now, that we know what works, and that the lessons from 40 years of the HIV response can and should and must be applied to broader health and human rights challenges. One of the main principles and learnings from the HIV response is the meaningful involvement of people with AIDS, or the meaningful involvement of the most impacted. And I think we really need to dig deep on what meaningful involvement means. I'm not sure that the word meaningful involvement is strong enough anymore. I think we really need to be clear about what we need is leadership of the most impacted people, and leadership from people with HIV and sex workers and people who use drugs and key populations. As we've seen, those communities are the ones that got themselves through this epidemic, sometimes in spite of us. And I would, the other thing I would say is that I think often about the need to, tear down silos between types of funders. We've learned that another silo we need to tear down is between humanitarian aid and HIV. But in addition to removing silos between types of funders, I think we need to remove silos between what we think of as funders, what we think of as implementers, and what we think of as community. And I think that intermediary funders do that well, and that more of our focus at FCAA should be on highlighting intermediary funders and their role and encouraging more money to flow in that direction. But we will be going through a continuing process with the COVID Learning Group to bring funders together to talk about the recommendations and to hear from funders how we can support them in implementing the recommendations and in highlighting them to an even larger group of funders.
Thanks, John. So inviting everyone to stay tuned for upcoming conversations, resources, ongoing discussion, as John just highlighted, moving communities as intentionally as possible into or strengthening, supporting their leadership, and the role of the intermediary funders. We are at time. John, I'm going to turn it over to you for the last words of thanks and to sign us all off today.
Thanks, Roxana. Thanks to everyone who joined us today. Thanks especially to our speakers and to our partners in sponsoring the webinar, and our partners in the learning group in putting this all together. We look forward to continuing the discussion. I also want to point out that May 13th, tune in for the release of our resource tracking report, which, spoiler alert, funding for key populations, not good news there in 2019. So join us for that webinar, and watch for our hybrid convening in November. Thanks, everyone.